More than 100,000 people have signed a cancer survivors petition demanding free dental care for those having life-saving chemo and radiotherapy.
Yeah, and that's in just 10 days, isn't it? Michelle Solak, who's from Flixton in Greater Manchester, discovered that such treatments can hugely affect the teeth after she was diagnosed with breast cancer. But she also discovered not everyone who's diagnosed always gets that advice.
No, and not every cancer patient can afford crucial dentistry, which the NHS won't always pay for. She came into our studio earlier and we asked how shocked she was to find that out.
I was really surprised. I think a lot of dental patients are caught out because they're given exemption from paying prescriptions for 5 years, and a lot of people think that that includes dental treatment, which it doesn't. Now, I happen to know it didn't, but it does catch a lot of people out.
How bad did it get for you, and what did you end up paying out?
Mine wasn't too bad at all. Mine was just, I think, shy of £100. But it was a time when not working, reduced income, so that £100 was difficult to find anyway.
It's a drop in the ocean compared to some people.
Absolutely. I've had ladies contact me, and gentlemen actually, who have had to pay £5,000, £6,000, £7,000, and that's just incredible. If you're not working, you're on benefits. Where are you going to get the money from?
And this is one thing that you are also very keen to stress, the importance of going to your dentist before you have cancer treatment, if you've got time.
Absolutely. The reason for that is because if you have poor dental hygiene, it can lead to infections in the mouth. And if you're having chemotherapy, any infections will stop treatment later on down the line. Not only that, it's really difficult to recover from infections when you're feeling poorly and you're having the cancer treatments.
But a GP doesn't mention that to you. A consultant often doesn't mention your teeth.
No, well, nobody mentioned it to me, actually. It was a fellow cancer patient who said, go and have your teeth checked. I mean, I was lucky that I went routinely anyway, but not everybody does.
Your petition's got more than 100,000 signatures in just a week, asking the government to pay up for dental treatment for cancer patients. Do you think the Health Secretary, the Prime Minister, going to listen?
I don't know. It's a difficult one. I'm just Joe Public, and so I don't know whether they will listen. I think having that number of signatures, and hopefully it will climb even more, it will mean that they will start listening. I met with my local MP, Kate Green, on Friday, and she's on board. She's going to write to Matt Hancock.
You say you're Joe Public, but you have got leading medics, high-profile doctors, high-profile dentists, all saying this is what needs to be done. You've got them on your side. You're not alone in this.
No, I'm definitely not alone in it, and I'm really surprised by that. The dental community are completely behind this. Lots of people say, why hasn't this been done before? Why hasn't this been highlighted or mentioned? And the answer is I honestly don't know why. And I don't know why my particular campaign seems to have hit the spot. I'm not sure, but I hope it carries on hitting the spot.
Well, we hope so as well. Michelle, thank you so much for coming in.
Thank you very much.
Yeah, Michelle Solak talking to us earlier, the Department of Health and Social Care. So they want everyone to be able to access affordable, high-quality dental care, and anyone with a low income can apply for exemption from charges on income grounds.
And they will ensure that by next year, every person diagnosed with cancer will have access to personalised care, including needs assessment, a care plan, health and wellbeing information and support.
Yeah, thanks to Michelle for coming in to talk to us about it. And there is more information about Michelle's campaign on our website. You'll find that at itv.com/Granada.
Go take a look. Still to come tonight,